my name's Helen. I've been a dental nurse for over 30 years. I'm an expert in dental anxiety. Why am I an expert? Because I have worked in over 100 different dental surgeries in 2 different states, and in those thousands and thousands and thousands of patients that I've worked on, if I only had $1 for every patient I'd worked on, I'd be a millionaire. And in my experience, I have found people are anxious, don't want to go back to the dentist because they don't want to have that feeling of being out of control. They don't want to feel vulnerable. So as soon as you put your head back, you're in a vulnerable spot. And then you have 2 heads at least looking down on you in your personal space. Then you have instruments into your mouth. You then have water. You have noise, and it's screeching in your ear. When you've got water, you don't feel like you can swallow. And because we all love to control lots of stuff, we don't think that suction's going to suck up the water fast enough, do we now? Feeling out of control, very vulnerable. Why would you want to do this to yourself? So your mind goes, no thanks, I'm not bringing you back there. No. So it reminds you of the negative experience that you've had back at the dental surgery. And so you don't go back. People don't come back for 1 year, 2 years, 5 years, 10 years. 10 years is very average. Then there's 15 years, 20 years. People have gone, I've only seen the dentist twice in their whole life, and they're 50. And I say, so why don't you want to go back? Didn't think I needed to, not getting any pain. You shouldn't have to get pain to go back to the dentist. You need to be servicing your teeth more than you service your car every 6 months, twice a year. That's what I meant to say. Don't mean to preach. I'm just so passionate about helping people get back into the dental chair, because there's so many people that just are so hard on themselves because they're not going back to the dentist and then they feel guilty. They leave it till the last minute. They then go back to the dentist finally because they just can't cope with the pain anymore. Generally, it's pain. That'll get you back. And what happens? Because it's so bad, the tooth has broken down so badly, or it's split, it needs to be taken out. Then what happens is a domino effect. The 2 teeth beside it collapse in because there's no other tooth to support it. The tooth up top then over erupts because it's used to chewing. So then you're missing that tooth, and just that one of your main chewing teeth. If you've lost that, I can guarantee you're throwing all your food onto the other side, overloading this side. This starts to then break down, cause pain. Hence, generally see patients back at the dentist or the surgeon, because I used to work with surgeons as well. And then because they've got to have the other tooth out because and it'll be up the top or down the bottom, generally at the back, because they've chucked all their load on. They haven't replaced the tooth here and overloaded on here, and of course can't take it, overloading, and another tooth needs to be taken out, same deal. And then the teeth then start to break down, especially if it's just like putting out little spot fires. Wouldn't it be better to just catch something when it just starts? Or it goes, you only need to clean today and we'll see you in 6 months. That's how cool it can be if you just can continue going back. So I am so passionate about helping people get back into the dental chair. The way I do it is in just a couple of sessions, very quickly, can release what you need, the problem that you have, and off you go. And then your life gets better and better. Why would you want to stay in the pain? causing you concern, worry, stress, anxiety, sadness, frustration, anger, doubt, all that negative stuff running around in your head. You lose sleep, you're tired, you're so run down. And then you just lose confidence because you can't smile, you're missing teeth. Teeth are going black, don't understand why. So there's so much stuff. And I can help you. Easy peasy. And I'd love to. This is my passion, my joy. And I believe it's my purpose to help people get back into the dental chair because I've understand how hard it is, and I've seen it. And in 30 years, I haven't seen much difference in terms of, even though the technology is a little bit better, it's still the same deal happening. And this is where I want to stop it happening from now on. So contact me, like, subscribe, and contact me. Love to chat.